Hi, my name is Joyce Arteaga, and I'm going to tell you about epidemiology of acute kidney injury in critical care children and young adults. Definitions. Acute kidney injury, AKI, is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. Acute causes a buildup of waste product in your blood and makes it hard for your kidney to keep the right balance or fluid in your body. Epidemiology studies involving adults have shown that acute kidney injury is associated with increased mortality, prolonged mechanical ventilations, and prolonged length of stay in intensive care units.
Acute kidney injury, or AKI, is when the kidney's not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into three types. Pre-renal AKI, meaning the cause of the kidney injury is coming before the kidneys, post-renal AKI, meaning after the kidneys, or intrarenal AKI, meaning within the kidneys. Watch the full video on osmosis.org.
Applications in medicine. The use of kidney disease improving global outcomes, guidelines to describe the epidemiology of acute kidney injury. They define and state acute kidney injury according to the plasma creatinine level and urine output.
Acute kidney injury, AKI, is a syndrome that results in a sudden decrease in kidney function or kidney damage. Acute kidney injury occurs in about 20% of hospitalized patients and in up to 40% of patients in the intensive care unit. Severely ill patients who suffer from acute kidney injury can have a death rate up to 50%. Acute kidney injury can lead to adverse events such as the development of chronic kidney disease or kidney failure requiring permanent dialysis. It may also increase your risk of heart disease or death. Let me walk you through this population plot figure to overview some of the consequences of acute kidney injury. Let's simulate we have 100 severe acute kidney injury survivors. Let's suppose 10 patients were discharged on dialysis. Of these 10 patients, 4 died. 2 recovered kidney function. And 4 developed chronic kidney disease or remain dialysis dependent. Now let's focus on the group that suffered from acute kidney injury without the need for dialysis, in this case 90 patients. About 1/3 died. 1/3 recovered kidney function. And also 1/3 developed chronic kidney disease or remain dialysis dependent. As you can see, adverse events such as death, chronic kidney disease, or dialysis are not uncommon in patients who suffer from acute kidney injury. What can you do after having acute kidney injury? Number 1, follow up with your primary care provider or kidney doctor to evaluate your kidney function recovery and your risk for post-acute kidney injury complications. Number 2, discuss with your doctor if your prescribed medications are right for your current kidney function. Number 3, avoid using drugs that are toxic to the kidneys, such as NSAIDs, for example, ibuprofen, naproxen, or herbal remedies. And finally, work with your doctor to identify modifiable risk factors and prevent recurrent episodes of acute kidney injury.
Pros and cons. Pros. That study showed great associations between the severity of acute kidney injury and outcomes. A single-center study involving adults revealed that mortality and morbidity were higher when both the plasma creatinine level and urine of both were used to diagnose acute kidney injury than when either was used alone.
Welcome to 101nursing.com. Today we'll be talking about acute kidney injury. What is acute kidney injury or acute renal failure? It is an abrupt yet reversible obstruction of our renal system or kidney system. What is the function of our kidneys? It's primarily to filter out waste products such as urea and creatine out of our body. These are toxic things. It also synthesizes activates vitamin D, produces renin. It also produces epigen, which is red blood cells within our body, and that's a very big function of our kidneys. And when that goes down, that's really not very good. It regulates our body fluid levels, osmolarity. It balances our electrolytes, fluid and electrolytes. We have an acid-base balances. It also balances out our blood pressure as well. If someone has a renal issue, they're automatically put into metabolic acidosis because it's bicarb that we use to compensate within the blood, within the body, if something is wrong with our kidney system. So if it's not functioning at its best capacity, our metabolic system is automatically put at a disadvantage. So there are three phases of renal failure. There's pre-renal, interrenal, and post-renal. We're going to break them down into different phases, but basically knowing that these three areas, pre-renal before the renals, before the kidneys, interrenal inside the kidneys, such as glomerulonephritis, that's a cause. Post-renal is renal calculi or UTIs, or various different types of infection that can occur that not only escalates to, not only is untreated, but escalates and becomes a very, very severe. One thing we need to know about this, it's very treatable through medication, and let's break down the renal process. Thank you very much.
Cons. The study of acute kidney injury in children has been limited. Retrospective studies involving children have used the KDIGO criteria, but none of those assess urine output in the diagnosis of acute kidney injury.
Hello, my name's Suzanne Doricott. I'm one of the critical care outreach team at the West Cumberland Hospital, and today we're representing the outreach team and looking at how you can help prevent acute kidney injury. Acute kidney injury is a sudden damage to the kidneys that causes them not to work properly. And in the UK, up to 100,000 deaths each year in hospital are associated with acute kidney injury. Up to 30% of these could be prevented with the right care and treatment. Today we're looking at trying to encourage people to remain hydrated and to take care of their kidneys. It's estimated that 1 in 5 people admitted to hospital each year as an emergency has an acute kidney injury. Acute kidney injury can range from minor loss of kidney function to complete kidney failure, and it normally happens as a complication of other illnesses. It's not, as the name suggests, caused by a blow to the kidneys. If we encourage people to look after their kidneys at home, then we can reduce the number of acute kidney injuries admitted to hospital, and you will be healthier as a result.
Issue applied in Ecuador. In Ecuador, the prevalence of AKI is 10% of the population and it is high undocumented mortality rate. A prospective study carried in Quito analyzed 2,279 patients admitted in ICU. The 92% meet the criteria of AKI. The main cause was sepsis.
Why are we worried about acute kidney injury? Kidneys ensure that the body fluid levels are regulated and that waste products and toxins are effectively removed from the blood. Acute kidney injury, or AKI, describes a rapid decline in kidney function over a period of days. AKI is usually diagnosed based on a rise in creatinine, a serum marker of kidney function, or a fall in urine output. What causes AKI? The most common cause of AKI is a reduction in the blood supply to the kidney. This can happen for multiple reasons, but it's most frequently seen in patients who are dehydrated or suffering from infections, especially if they are taking medication that can potentially reduce kidney blood flow, such as diuretics, for example furosemide, angiotensin-converting enzyme inhibitors, such as ramipril, or non-steroidal anti-inflammatory drugs such as ibuprofen. Given these risk factors, it is no surprise that acute kidney injury is a common condition in hospitalized patients. Studies suggest that up to 1 in 5 emergency admissions to hospital will have AKI. Why is AKI important? AKI is a serious medical condition with a mortality rate of between 30 and 40% for the more severe cases. In most cases, acute kidney injury is treatable. However, a good outcome hinges on early recognition and timely treatment. What treatments are available? In the majority of cases, the treatment of AKI is relatively simple and involves withholding potentially damaging medication and the administration of intravenous fluids. It is vital that these interventions are administered early to minimize the risk of acute kidney injury progressing to a life-threatening stage. As well as timely intervention, it is imperative that patients with AKI are monitored for signs of deterioration. Fluid balance monitoring in particular is of crucial importance, as the urine output is a good marker of kidney function. What is AKI Pro? AKI Pro is a program to improve recognition and treatment of acute kidney injury. Ward teams will get extra reminders about deteriorating creatinine levels. By using a specifically designed urine output measurement tool called the wheel, we will improve the quality of output monitoring. Patients will be able to help. We have written information, and the Kidney Safe bracelet reminds patients, carers, doctors and nurses to monitor quantity and quality of the urine. We're using nationally collected lab data to analyze trends in the prevalence of renal failure. With your help, we're hoping to give patients better fluid management, safer prescribing, improved urine output monitoring, and earlier repetition of abnormal tests. If you want to get involved or discuss AKI Pro, please get in touch with your local renal champion or email us at christian.subi@wales.nhs.uk.
Conclusions. This large, prospective, multinational study of the epidemiology of acute kidney injury in children and young adults in ICUs showed that acute kidney injury occur in 1/4 of patients during the first 7 days after ICU admissions. Severe acute kidney injury confer an incremental risk of death by day 28 and was associated with increased use of renal replacement therapy and mechanical ventilations and longer stay in the ICU. Thank you.